Thank you, sir. And let me thank the organizers for inviting me to be a part of this very contemporary and contemporary meeting with a lot of implications for modern cardiovascular medicine. It was the end of a fantastic session, so I'd like to start from the very first talk by Dr. Kiran Musunuru, who spoke largely on the implications of gene editing in cardiovascular medicine. And he chose to focus on coronary artery disease because, as we know, the tremendous burden in heart failure is driven by the process of coronary artery disease world over, and especially in our subcontinent. And essentially, he spoke of gene editing in the PCSK9 and ANGPTL3 genes, which are essentially modifications which are attempted to reduce the level of triglycerides with ANGPTL3 and reduce LDL levels with PCSK9 modulation, because those two appear to be the crux in achieving significant reductions in triglycerides and LDL as a result of gene editing. Of course, the therapies, he mentioned that the therapies that we have now with us are limited in terms of chronic therapy, and which is recurring therapy in terms of PCSK9 inhibitors and the new inclisiran, which is aimed at against PCSK9. And the good news, I think, that he's sharing is his center in association with Dr. Kathiresan from Mass General, is that we may be on the verge of a vaccine for coronary artery disease, which has been the holy grail for cardiovascular medicine specialists for many, many decades. And if the trials go forward in human studies, and the data which he mentioned has been quite proven in animal models, base editing, gene-based editing with CRISPR-Cas9 systems can favorably modulate ANGPTL3 and PCSK9, leading to significant and sustained reductions in triglycerides and LDL plasma levels, which can significantly reduce the burden of cardiovascular disease, again, bringing us to the verge of a vaccine in coronary artery disease, and therefore markedly reducing the burden of heart failure. The second talk was Dr. by Sandeep Seth. I think it was a very contemporary talk, and which all of us were very keen to listen to, because it's addressed to the raging pandemic in the midst of which we find ourselves in. And of course, he clearly mentioned that the cardiovascular system clearly takes a big hit in COVID-19. We are just beginning to understand the mechanisms of how it does so. And he narrated the mechanisms in the context of certain clinical examples in which we could clearly see young patients fully recovered from the COVID syndrome in the initial periods, presenting with gross heart failure in the subsequent phase of the disease. So there are various mechanisms which he underlined could lead to the involvement in the cardiovascular system, ranging from involvement of the renin-angiotensin-aldosterone system axis, the inflammatory cytokine cascade, and other related pathways. So I think the data is quite clear that we need to characterize these pathways more, to understand these pathways before we decide, before we even begin to design a treatment pathway to understand and treat these patients better. The third talk was by Dr. Sheila Nambudri. Madam is from my institute, and as always, it's a pleasure to listen to her, and it's a pleasure to work with her. So Madam clearly talked about the role of genetic counseling within the context of cardiomyopathies. And this is, I think it's very important, because accurate phenotyping of the disease will lead to the question of whether you would need to perform genetic analysis in any form of cardiomyopathy. I think the message that she was trying to bring forth is phenotype these patients accurately so that you can ask a clinically viable genetic question. And if the genetic question reveals a significant genetic abnormality, such as an hypertrophic cardiomyopathy or a mimic of hypertrophic cardiomyopathy, as in PRKG2 or Fabry disease, then that has huge implications for the treatment, prognosis, and counseling for the families. And towards the end, and definitely not the least, I think it's the hot topic in terms of epidemiology and the other branches of internal medicine, biobanking. And to speak to us about biobanking was Dr. Meenakshi Sharma. She mentioned that the concept of biobanking essentially includes the collection of tissue specimens along with related health data. And I think she also very elegantly showed that doing this process has clearly borne fruit in an established biobanking system such as the UK biobanking system. And from the cardiovascular point of view, there has been significant contemporary literature which has been published from the UK biobanking system concerning cardiac MRI and LV morphometric data. So that's one application in terms of cardiovascular system, which I can recall coming out from the biobanking system. She also mentioned that storing clinical data in terms of the imaging data and the genomics data has huge implications for the population as a whole, especially the heart failure population in our country. And Sri Chitra Institute, I'm proud to say, in our state is at the forefront of initiating this whole process. She also mentioned that the storage methods, the database standardization, and data protection are also important concepts in this regard. Thank you.
Thank you, Hisham. I think first I would like to thank Dr. Harikrishna and Dr. Karta for asking me for actually listening to this session, because I'm a clinical cardiologist who has been, I'm really been fascinated by what goes behind the scenes. All the talks were really brilliant. Dr. Kiran discussed the role of I was fascinated by the development of this, how the concept of PCSK9 and the second thing, the ANGPTL3 and the CRISPR techniques that he mentioned. And as a clinician, I was impressed, really. And I wish that the girl he showed will have a good therapeutic option by something that comes out of the labs. Because as she said, it is very difficult for us to treat these patients lifelong with drugs. Probably gene editing and finding a treatment option for her would be a real boon for these sort of patients. Dr. Sandeep discussed about the mechanisms which are already Dr. Hisham has already said, and regarding the multi-organ damage and the fulminant. Another thing that which is striking is the history of sudden cardiac death in patients with post-COVID who doesn't have any other manifestations of heart failure, die suddenly. That's again something which we need to look into. But what he emphasized is the lack of myocardial damage in patients with the post-COVID heart failure patients. Dr. Sheila again emphasized the clinical findings, how the clinical findings with genetic studies will have to be combined for optimal patient care, because we tend to miss a lot of patients with dilated cardiomyopathy, hypertrophic cardiomyopathy, where there is a treatable cause which we miss, and then we are not giving them optimal treatment. Regarding biobanking, again, one of the most hot topics that we are going to hear in future. I thought the most important thing she emphasized was the security part of it. I think it's one of the things that when you have a biobank, the establishing a data protection probably happens to be one of the most important things. And I think and I just was looking at the UK biobank, this thing where they have the largest biobank in the country, in the world, I think. It is very interesting to go through this data. And I hope that we develop more and more use of biobanks for us in this country also. And let's hope that our own therapeutic options will improve as a result of all these aspects in our patient care. I think with this, I would also like to conclude. Again, thanks for all the 4 brilliant speeches. And I have really enjoyed listening to all these things. Thank you so much.
Dr. Chopra, for the day's summary and the future perspectives.
So I think for me, it has been a unique experience to attend this meeting, totally different than the meetings that I think as cardiologists, as clinical cardiologists, we attend. And it has been, very humbling to see the kind of basic research being done in our country. All the talks were brilliant. Yesterday, of course, was something which went largely over our heads because it was all basic science. Today was a lot more clinically relevant, which we could understand. But the talks have already been adequately summarized by Dr. Hisham and Dr. Venugopal. But I would like to say a few words about my views as a clinician. As our scientists carry on with their research and delve deeper into the mysteries of human body and science, there is no doubt that you are going to discover new pathways, new molecular mechanisms, and ultimately come up with new pathways and new ways to tame the diseases. For ultimately, whatever we do, it has to benefit our patients. See, already in heart failure, in the last 4 or 5 years, we have seen 4 new classes of drugs and a lot of innovations in hardware, arrhythmia mapping, and so on and so forth, which have positively impacted the way that we treat our patients and give benefit to these. all these are great, but there are two problems. One is a cost of new technology, leading it to not being available to a vast majority of our patients. And second is that clinical trials always reveal binary results. Maybe 20% people benefited, there was a benefit in 20%. But did everybody benefit? No. Did people get harmed? Some people, probably yes. So we need to go into personalized medicine. And it was great to see the speakers and the director of Sri Chitra also emphasizing on those points, that we need to ultimately develop personalized medicine with biobanking is a great concept. And I must congratulate ICMR and Sri Chitra for being in forefront of that. And there's no doubt that we'll come up ultimately with some of these, because how many drugs will we keep on stacking? You know, we started off with beta blockers, diuretics, ACE, ARB, ARNI, SGLT2 inhibitors, and now there are very Sigwart and so on and so forth which are coming up. There's no doubt that as you discover new pathways, new drugs will come up. So how long will we keep on stacking one medicine over the other? So we really need to identify which patient is going to benefit from which drug, and which are the drugs which are not going to be effective in some people, so that they can be deleted, or a superimposition of those drugs may not be required. So I think these are the areas that I see as areas of future research. But I have no doubt with the kind of work that we have seen today and with the kind of talks that we have seen today, the future is bright, and I'm sure that we'll come up with great ideas. With this, I would like to thank Dr. Kartha and Dr. Harikrishnan for organizing this great meeting, and we look forward to similar experiences tomorrow also. Thank you.
Thank you, Dr. Chopra, and we thank all the participants and the faculty for a wonderful session over these 2 days. And I invite Professor Kartha to say the final word, and we'll close the session. Good night from our side.
What an intellectual feast. I was just going back to our own student days when Venu and I were, medical students. We had only digoxin and Lasix or mercurial diuretics to treat patients with heart failure. And we are now talking about stem cell therapy, gene editing, and selective drug use using pharmacogenomics and whatnot. I see I can see the future cardiology, a slice of future cardiology today. Thank you very much for all the speakers for enlightening us, giving very stimulating and thought-provoking lectures today. Thank you all.
Yeah, and we have on announcement, we have our annual conference of the Heart Failure Association of India, the Heart Failure Virtual, happening on 12, 13, and 14, that Friday, Saturday, and Sunday of February next week. So please join us. It starts at 5 a.m. to 10 p.m. every day, 3 days. So
Not 5
wonderful
5 p.m. Hari.
5 p.m.
Sorry, 5 p.m. to 10 p.m.
5 a.m. is too early.
Welcome. All of you are welcome. The registration is free. You can come and join us. Please do join. Thank you so much. Good night.
Thank you.
Thank you. Good night.